Welcome, everyone, and I am incredibly honored to introduce my dear friend, Dr. Wendy Oliver-Pyatt, who is one of the co-hosts of Weight Stigma Awareness Week, and this really would not have happened without her. So I'm so appreciative to her and to all of the people who are part of this and helping us. Dr. Wendy Oliver-Pyatt is a world-leading expert on treating eating disorders. With more than 25 years of clinical experience, she has developed 5 distinctive treatment programs, all grounded on a strong psychosocial foundation and incorporating intensive psychotherapy with behavioral foundations and a high medical standard. Wendy has developed a unique treatment approach that delves into the underlying issues that place a person at risk for mental health conditions and eating disorders and lead to healing, health, and inner peace. So I'm going to turn things over to Wendy now, and I just want to add that at the end of Wendy's presentation, she and I are going to close Weight Stigma Awareness Week with a couple thoughts, and we'll go from there. Wendy.
Thank you, guys. Thank you for allowing me to be here today, everybody. I want to start by saying my name is Wendy Oliver-Pyatt. I go by she, her. Shavis has really been a friend and a partner and a mentor, and she's taught me a lot as well over the years. And I wanted to start, and I do really appreciate being able to take this moment to say that I am a white, thin female with a tremendous amount of privilege and influence that I've been blessed with, that has given me the opportunity to be here with you today. And I come here to Weight Stigma Awareness Week with the deep awareness that I don't walk in the shoes of people that experience the trauma of weight stigma every day, over and over and over and over and over. I do have internalized weight stigma of my own, and I think most anybody in our world has it. I did have an eating disorder, so I do have internalized weight stigma, all forms of eating disorder. And most people, even without eating disorders, I think, well, almost all people that have internalized weight stigma. But what's different is that I haven't suffered the oppression of weight stigma, which is so profound that is beyond, I think, an ability to even verbalize. And by being here this week, it's just even brought it out even more. And I am so sorry for the hell that people have been put through. And the whole idea of doing Weight Stigma Awareness Week came about in, I believe, 2011. And I think what's good is that we are more ready for weight stigma awareness in our society, but at the same time, we're so far away from where it should be. And the thing that's so brutal about it is that, and sad and frustrating, is that the thing that people really want and need and deserve is so freaking basic to just basic human decency. And even after I came up with this title just this morning, I was thinking, getting what you want, need, and deserve. And, it's like, that's a little bit of a, that's not really true, because it's like, I can't sit here and talk with you and tell you what there's no way that you're not going to get what you are, like, it's going to be really hard for you to get what you want, need, and deserve because of, diet culture and fat phobia. It's so this title of this talk is not quite right. I realized this morning. At the same time, I do want to, share what I can share in hope that it can be helpful. Just knowing that it isn't, it's the system is so screwed up that we're so far away. At the same time, again, going back to when I first entered this field in 2003 with my first treatment center to now, I can truly say there has been a ton of progress And I think our culture is way more ready for this. But at the same time, the Academy for Pediatrics just came out with guidelines to suggest kids could get bariatric surgery. So it's hard to say that completely. I will love any questions that you would want to put into the chat. And Shavis will, at the end, we'll go through them together. And so I would love to hear from you. I have found out that I do make mistakes, and I have made mistakes in my professional career. And I'm open to any, feedback, and you can tell me that didn't feel right or whatever. I'm open to that and interested in that. And also toward the end, I wanted to just open it up that if anybody wants to, and I recognize I don't want anybody to do anything, I don't want anybody to labor for me, but if anybody wants to share things that they want and need and deserve in the healthcare system, like I really like to hear that and just put pen to paper and keep thinking about it for when I can, have an impact and try to have an impact. We had an impact council meeting on Tuesday, and I was in the group that was talking about, healthcare and what we people want, need, and deserve. And I will say that some of the things that came up were so simple, but so important, but yet so far away. One of the first people that spoke in the meeting said that, and she's, oh my gosh, such a brilliant human. And she was like, whenever I try to talk about this and when I want to be able to say something about this, she's basically, kind of in a sense shunned because she lives in a larger body and all the stigma that's tied in with that. And we were just talking about at the end of the day, like one of the first things that we really need to start seeing happening is that we need people with lived experience to have a seat at the table. And that's something I really appreciate about Shavis. And Shavis is oftentimes really talking about lived experience. And I do feel in the field, mental health field, lived experience is starting to take some root in validity. Like, earlier on, it was always like evidence-based, evidence, but double-blind placebo, blah, 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 blah. And, all that research that was being done wasn't really even done on like diverse communities in the first place. And really all the really breakthroughs that have happened in mental health, like all of them that I can think of that are really big, come from people with lived experience. Whether it's like Marsha Linehan, who had major mental health struggles and she developed DBT. Francine Shapiro had trauma. Her sister had very serious cancer, and I think passed away from cancer. Francine Shapiro developed EMDR through her own pain and suffering. Many breakthroughs in our mental health treatment have come, and certainly the things that I will talk about were things that came from people who suffered through lived experience, right? This is what, as we were talking we did a fireside chat, like I'm just like following all these other people who had way more oppression and faced much different barriers. Like I get this sort of pass because I'm a doctor and I'm thin and all that stuff. So I get to sort of say stuff and like, it doesn't get met with the same force and oppression. And that's really important to like acknowledge. And yet at the same time, I do want to be an ally and I do want to spend every day trying to make things better. So that lived experience was one of the very first things that we were saying. People that are affected by weight stigma need to have a seat at the table to help deal with weight stigma. And that's one of the things that we really tried to do here. And that I really credit Shavis a lot with really putting a line in the sand and saying, we need to give people with lived experience the voice at Weight Stigma Awareness Week because they haven't had the platform they need. And I really feel great that happened. And Shavis was really steadfast in that. And it made me very happy to know that was what we were able to do. It was fulfilling to me. One of the other kind of principles that is like so far away in healthcare is the idea of collaboration. And I really think that that's an important principle of just healthcare in general, like shifting the paradigm from a hierarchical, like I'm telling you what to do, to a collaboration. And I think one of the things that should be taught in medical schools is I think doctors should be taught when they walk in the room, they should be taught to say, how may I serve you? How may I serve you? Because you're there to serve and you're not there to dictate. Another thing is just that people who are falling into the trap of diet culture are just trying to have basic human decency and access to basic things that they should have access to, which is just insane. But that is really, people are falling into this misery of diet culture, but they're just trying to have like decent human experiences and not be traumatized. And we just have to always remember that. Even we also need to think about in our communities, I feel like I don't want to just preach to the choir, I want to, that's something that Shvis and I talk about. Like, we want to, it could be like enemy territory, right? But it's like, we want to go where people are at and really get there and then kind of try to march forward. And that's going to take, if we just come at it like we have to come at it from the point of view, as hard as it is, like understanding that all these very privileged people sometimes are still like they're prey to their own ignorance too. And that's just a reality. And so we have to like grapple with that. And I'm here to try to help and try to make it so that not everybody that's affected by it has to fight. Like, I want to fight some of that too. Like, I want to put my gloves on and be able to help. And that's one of the reasons why, I'm doing this. I have family members that are affected by this every day, in deeply painful ways. And it matters a great deal to me. Thank you. I believe that at the fourth, at this point, we do know what weight stigma is, but I do think it warrants just saying, what it is weight bias and it's judgment. It's judgment and stereotyping at the end of the day. And it's no different than other forms of discrimination, and that there's an incredible thread of similarity between racism and weight stigma. It's about judgment and stereotyping. And it does fuel very terrible behavior, bullying, hate speech, and exclusions that limit the ability of the person to gain employment, healthcare, education, and just peace in their relationship with themselves, peace in the relationship with their body. And one of the things we really will talk about is the healthcare and that lack of the way that people go through stigmatizing experience in healthcare. It results in a lack of healthcare. And it's just ridiculous, but that is what actually is the reality of it. So we talked about what it is. It's stereotypes. It's the idea of deviance from what you're supposed to be. It's discrimination, and the stigmatized person develops a devalued social identity, which is also, that is not okay. The idea of a devalued social identity, somebody going through that is just like very painful. And we're here also to try to help change that. I gave a talk yesterday on shame I'm at this conference in Costa Mesa called Emergence, and I got to talk about the subject of shame. And so I did an experiential where I asked everybody to write down, if they wanted to, something they're ashamed of, crumble it up into a piece of paper, throw it at the stage, heave it at the stage. And then I gathered it up, and then we read what people, were feeling shame for, about, because it's very, it's very humanizing and connecting for us to understand like that all human shame is a common, thread of we all experience some forms of shame, but to put a voice to it, to be, to share with others and find our common humanness is very powerful. And also to physically be able to release it is important. That's why I said, throw it. But so many of the people, of course, were having shame related to body, because that is really the most common, like, form of shame that is really just common. We'll talk more about that. Whether you have and it's again, eating disorder or not eating disorder. Weight discrimination terms occurs more frequently than gender or age discrimination. It's been increasing a lot. Peer victimization is predicted by weight. Individuals, kids who are victimized by their peers are 2 to 3 more times likely to experience suicidal thoughts and behaviors than those who are not victimized. And remember, it's the stigmatizing experience. It's not the weight. It's the stigmatizing experience that's causing the adverse psychological outcomes. Just some of the other things I just want to mention as far as like the history of this goes is that going back to our history with BETA, this isn't going all the way back to early weight stigma, but to our history with BETA in the early 2010, 11-ish or 8, 9, 10, when we really started to talk about it, we were like we were thought of as a little kooky to be talking about this. And when we were beginning to talk about what's now popularly called health at every size, we were a little bit, got a lot of the eye rolling. And so it does give me a little bit of hope, I guess you could say, that I see the field now, kind of making movement. In fact, I I was on this eating disorder professional research, eating disorder professional group on Facebook. And somebody was like, does anybody know of a Hayes, blah, blah, blah clinician? And like, there was this like, everybody was like, I'm Hayes, Hayes. Everybody's like, Hayes, And I was like, holy shoot. Like, I was like, we used to get like our eye rolled. We got like, we were shamed for like believing in those principles. And I would have to like get together with people and just be like, guys, this is what Hayes says. People didn't even know what it meant. They just concluded all these things. But now people are like wanting to endorse that they are Hayes oriented. So there's some movement here. There's some loosening up of things. So again, so much further to go, just tip of the iceberg, but yet, okay, made a little headway here. That was kind of nice to see. It made me laugh though, to think about it. Something that I think is, and I'm pretty sure this audience knows this, so I hope I'm not just like, again, preaching to the choir. But as I was mentioning before, is that that weight stigma is trauma. It impacts, thoughts, feelings, and behaviors across all boards, and certainly in healthcare seeking activities. And why is that? Why is weight stigma? Why is it affecting people the way it is? Well, shame is an experience that we've all had, and shame is a evolutionarily retained emotion. Actually, Darwin first talked about the emotion of shame. He was one of the first people. He was really the first writer to talk about just emotions, like what are actually emotions, and he talked about shame as an emotion, and he was able to begin to write about that. We start to understand, what shame is, and one of the things that shame does is it creates social hierarchy and orders, and it kind of keeps people in their place in a sense. So it contains and retains hierarchical systems. It kind of shuts people up in a sense, because when you feel shame, the number one thing that people feel when they feel, one of the things that people do when they feel shame is they shut up, they go away, they don't come out, they disappear, right? Physically, they just don't even want it. We were talking yesterday, it's like people are saying, they didn't even want to leave their house, and so it's like shame has these profound, effects, and it really does even affect your identity. So we internalize a way that we feel about ourselves based on internalization of feelings, beliefs, and attitudes. Okay, feelings, beliefs, and attitudes from what other significant people say. So it's what I say that's going to affect how somebody's going to internalize this. Words mean something, right? Internalization in the way that people are treated. So it may not be what I say, but it might be the way that I am treated that is affecting how somebody's going to internalize that. And also these are, these processes happen through images too, these images that get unconsciously, into ourself. And so this is the way that shame gets like kind of into and burrows under and affects the soul, the essence of who the person is. And I believe that each one of us is born with this essence where we want to love and be loved. We want to belong, we want to connect, and we want to manifest our potential, whatever that may be, to some extent. We don't get to always manifest fully, but I believe that in our essence, these are things that we all want when we come out into the world with this. But shame pushes all of that away and creates the need, because it's so painful, to build defenses against it. Oops, why is this not going forward? Experiencing weight stigma does increase the likelihood of engaging in many different kinds of unhealthy behaviors. It's when people say they talk about how do they cope with weight bias, like many times they might eat more food too, let alone like just all the other terrible things that happen. So it's just the doctors themselves being so clueless about how their help doesn't help. So there was some research Brene Brown talked about just 200 participants talking about things that they felt ashamed about. And so this is like the identity, appearance, sexuality, family, motherhood, parenting, health, mental and physical, aging, religion, and ability to speak for the self. These were all the categories that people reported of what they felt shame about. But body image was closest to the universal category, that over 90% of those participants did report body shame. And the other thing that's important to consider is that what's shaming for me may not be shaming for somebody else. And I think that is a big problem in healthcare, that doctors are just taught, BMI chart, prescribe Ozempic, recommend bariatric surgery, Now, I give this example. I have my brother Glenn. He and I are very, very close. I had an eating disorder. He never had an eating disorder, right? Now, if I'm told as a 13-year-old, Wendy, your thighs are a little thick or something like that, which is something that I was told. I was in ballet or whatever, right? That was like deeply, deeply, deeply shaming to me, right? Whereas my brother could be told something and it's not going to have the same experience. So different, healthcare providers don't have that training either, of like, who's sitting in front of you and what are you talking about and how are their different vulnerabilities going to be affected by this. And this is the same thing that we pointed out when we wrote the guidelines for the O prevention programs in 2006. Like, one of the things that we talked about in there is like, when authoritative institutions start taking these pathways forward to supposedly help people be healthier, but they're not thinking about the audience, their developmental, place. Not to say that there's any good anyway, but when we do things in healthcare, but we haven't tested it, we haven't talked to diverse communities, and we don't know how people are going to be affected by it, we just start doing it, we get into a lot of trouble with that. I think that just important to say again, shame and stigma is very obviously interconnected. And I don't love this definition, but this definition really hit home. The most common view of shame is that an intensely negative emotion directed at the self as the result of having to fail to live up to some standard, ideal, or norm. And that standard, ideal, or norm is sort of agreed upon societally as being the right thing. And authoritative social institutions are well known to fail in terms of like what is healthy. Like, let's take cigarettes, for example, right? Authoritative institutions could come in and put a stamp of approval on something and say, do this or do this or that. But we sort of tend to believe it without really, testing that. And especially healthcare providers and doctors, there's a commonly viewed belief that, as they say, doctors know best, right? And doctors, we tend to think we do know best because we're programmed to have a superiority complex that we do know best. And, we can't even just be called Wendy. We have to be Dr. Oliver, it's like as if like, some kind of like holier than thou thing comes out. It's like, and so people that don't know much about this, of course, if the doctor is saying, to put your child on Ozempic or Wegovy or consider bariatric surgery, it's the doctor is telling you, and the doctors know best. And it's sort of this like, this idea that they just know best. And the most people wouldn't have a reason to doubt that either. So it's very dangerous. This is a study that just showed, where the sources of bias actually comes from, and families are number one and doctors are number two. I really find that the issues with doctors we're going to talk more about is unbelievable. The amount of healthcare that is not being delivered. And actually the antithesis of healthcare, harm, is being delivered by doctors due to weight stigma. It's so rampant. And I think most people living in larger bodies have had to go to doctors, if they were brave enough to go, right? Have had to go to doctors, not expecting to have a positive experience, but actually expecting to almost go to battle. And again, this is just something that's not acceptable. We have such a long way to go, because I think the whole construct of how healthcare is thought about and how we're trained is like missing like some of the basic elements of, like, for example, training around the idea that any intervention, any interaction with anybody in that's supposed to be healthy, like we should always be asking ourselves, how did I do as far as connecting to that person? How did that person feel in the interaction with me? It's not just about saying blah, 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 right? We're not trained in medical school, I promise you, to ask ourselves, I wonder what that person felt like during my time with them. I wonder how I left that person feeling. And in the Impact Council, one of the members had stated that when she goes to the doctor, she kind of knows this is going to happen. And she had just gone to the doctor. And she goes in and she knows she ends up having a tremendously painful experience when she's enduring the weight stigma, and she holds it in so she can get through it, and then goes out to the car and cries. And like, maybe she was just trying to get like a script to get a mammogram, you know what I mean? Or maybe she just she needed a pap smear, or maybe one of my colleagues was telling me that she had some orthopedic things, and she went into the doctor and she came out with a diet plan. The doctor this is a really well-informed clinician. So that's some of the stuff we're going to talk about in this, like, how can you prepare for these appointments? But I want to start by saying you shouldn't have to prepare. So everything we're going to talk about today, it's like actually wrong that you have to do this. Like I say to you, I am sorry that you have to be prepared. You have to be prepared. I want to say that I think it is a really good idea to have a friend or a colleague. Sharice and I were talking about this. We actually had this idea of like, maybe we could make different cities. We could have like allies in different cities, so you don't have to go to the doctor alone. And just fight for your health care. So I am sorry that we do have to have this conversation about how to get try to get what you need in the doctor's office. Because you shouldn't have to fight to try to get your basic needs met going to the doctor. And it's an absolute shame that is the way it is. Obviously, orthorexia is just like woven into our culture. And, my mom used to tell me the road to hell, is paved with good intentions. and social institutions, have weight stigma fully baked into their protocols, and insurance companies will be happy to authorize bariatric surgery for you. But you take the same person and you try to get them mental health treatment, or maybe they have eating disorder issues, and if they live in a larger body, the insurance is going to say it's not medically necessary. This is adapted from Rebecca Poole. I adapted it though, because it had some words in it that I prefer not to use, but I think I want to give her full credit here, is that, that when you go to the doctor and you experience the bias in the doctor, then you're going to have understandably painful feelings and avoidance of healthcare. And that's going to affect your own healthcare education, monitoring, and prevention. That's going to increase health consequences. And then you would probably need more medical visits. So you're probably not going to go, because it's just going to be this like terrible cycle. We've already been talking about that. And then there's so many problems that we've talked about. No data, of course, supports that higher BMI causes poor health outcomes. In fact, those that are a little bit higher actually have longer survival than those that are a little under, quote unquote, normal BMI. One of the problems that I really think is a big problem in our culture is that there's so much talk about the O word, but most doctors don't even know. They literally don't even know what weight cycling is. You could be like, oh, you're talking about, oh, well, dude, what about weight cycling? That's the more predictable outcome of this diet that you're giving to these people. Have you thought about that? And one of the things that I say is that any medical intervention should have you should be giving a risk benefit analysis to people if I'm prescribing medication, if I'm saying, let's get a colonoscopy, right? I have to get consent. I have to say, I, as a physician, have told you the risks and the benefits of that intervention. But dieting is a medical intervention. It's an intrusion into your body's cues of hunger and satiety, which is a cue that is architected evolutionarily over our whole evolution based on survival, not based on self-destruction. Yet doctors do not see imposing a diet as a medical intervention. Any intervention should have a risk-benefit analysis. And the true risk of dieting is weight cycling and eating disorders or disordered eating, or basically a relationship with food that's not peaceful. And if you don't have a peaceful relationship with food, you're screwed. I mean, I have a picture of myself, age 21, birthday cake, college student, and I'm just sitting there looking like this, I have this like fake smile because I'm sitting there with a birthday cake, and I have like literally no idea what I'm going to do with this birthday cake. It's a freaking birthday cake on my 21st birthday. I'm totally conflicted about it. School-based interventions need to stop promoting weight stigma. They should not target any particular kids, and should provide activities that are joyful, that are equitable for all body sizes and shapes. I think it's important to explore anti-fat attitudes and recognize how important those attitudes are in our interactions as healthcare providers, and become educated and own this. We all do know that the Academy for Pediatrics came out with these new guidelines, which, the intensive health, behavior, and lifestyle intervention is probably, I would say probably nothing more than some form of a diet or healthism. And then also, recommending weight loss pharmacotherapy, and potentially bariatric surgery. And again, using BMI as a tool to determine that. And BMI is absolutely bogus and is also racist, because different people of different backgrounds are going to have different constitutions of muscle, fat, fluid, bone, so BMI does not really correlate with health at all, as I think most of us on this call know. It was developed in the 1800s by a mathematician. It's just literally a formula. It doesn't even measure body fat. Even if it did, body fat is okay, guys. Like, fat is an organ system. It's considered like an organ system. We need fat. Fat is not, a bad thing. Fat is a part of our physiological makeup. And so even just the idea that it does or doesn't measure body fat directly, like, that's one thing, but it doesn't even like account for the fact that we all need different kinds of body fat. Like, if I was at a different body fat than I am now, that might be quote unquote normal. I might have a very disordered relationship with food. I had to be able to come to terms with like what my body weight and my body fat is for me. Not based on a mathematic formula from a Belgian mathematician in the 1800s. And this is what, has been happening in our schools. So getting a little bit more onto some of the things that we want to get into, that I want to make sure we have some time. So I'm going to move a little bit more quickly. Just some of the myths are that, the one that is really pisses me off is people in larger bodies have issues of defects of character. Bullshit. People in larger bodies have to survive weight stim every damn day and go through intense trauma and have to develop incredible strength to survive the onslaught of trauma they go through every day. That, people in larger bodies, don't inherently have more medical problems. They don't inherently have less discipline, or they also don't like, people in larger bodies, like, don't actually necessarily eat more than people in smaller bodies. That's a big idea, a big blowing it in healthcare. Oh, the calories in, calories out, blah, blah, blah. Like, I know a lot of people. I've trained a lot of people. I've had a lot of people in controlled settings, and I know exactly how many calories they're getting. And I know what movement they're doing because they're in my residential program. And so I know that people in larger bodies are not just eating more food than people in other size bodies. A lot of times the people in the smaller size bodies are eating quite a lot more than the people in the larger bodies, as a matter of fact. And that's a big problem in healthcare, because people in larger bodies go to treatment and get put on restrictive meal plans, which is a form of trauma and neglect. Sorry, this one gets me mad. Health at every size. I mean, when we first started talking about it, you would have thought this is the anti-fat bias thing going on, right? Like, you would have thought we were like talking about some insane thing. I mean, health at every size is about health enhancement, weight inclusivity, eating for well-being, respectful care, life-enhancing movement. These are just the basic principles of it. And I guess what I understand now, these have been updated. So this is probably a little bit outdated, but these are basic human needs. And it really is about accepting and respecting the natural diversity of body size and shape, eating flexibly that honors our cues, and joyful movement. I mean, you would have thought when this came out and when we started talking about it, I was doing, by the way, I was doing health at every size before it had a name. And this is just because I had an eating disorder, and I got through it by understanding this. But when it first was getting talked about in the field, we were really shunned for health at every size. Shavis knows about that. Just some people that really led the way. I just think that it's amazing. Back in 1967, people were already starting to talk about this and protest societal fat phobia. So that these were the real pioneers. These were the real leaders. And just some really cool little book images that bodies are cool. Just the idea of bodies are cool. Just another thing to have in your pocket when you do go to the doctor is that this shame that is happening actually causes dissociation when you eat. The shame and the anxiety makes it really hard to eat mindfully. So all that shame that's getting put upon you makes it harder to just be in a state of self-awareness so that you can deal with hunger and fullness cues and you can eat for satiety, because the imposition of the shame rattles you and traumatizes you and makes you feel dissociated. And the only way to do that is through, obviously you have to understand what's going on, and you have to know, oh, I can do exposure therapy, and I can be, obviously you have to be around people that can help you understand what is actually going on here. Like, you're not like struggling around food and or binging or whatever, because you're just inherently just, this person that just is gluttonous. Like, you're probably already restricting. You are restricting, because binge eating disorder is a restrictive condition. Just I'll say specifically about binge eating disorder is a restrictive condition. I can tell you that from, again, firsthand experience of treating this for 20 years. It is a disorder of restriction, but you also have the restriction with food, and then you have the shame. You've been shamed, so you're like a double whammy. So it makes it very hard to be calm and mindful when you're eating. So we have to do exposure therapy, and you have to help people understand the paradigm of healing that you need to be in. And then over those exposures, then as the shame is going down, then the capacity for mindfulness increases. Most doctors don't have the foggiest idea of this, unfortunately. I think you guys already, this audience knows what a weight inclusive, approach actually includes, and it does need to fall into public health settings too. Again, we have a long ways to go with that, but I mean, it does really involve first doing no harm, which is, the first thing we're supposed to do in medicine is to do no harm, and really thinking about day-to-day life and living in the moment and mindful self-awareness and gentle self-care and critically evaluating evidence, and practices and environments where health care and health behavior. That's when I say healthy, I really want to make sure I know, it's like, when I say healthy, I mean healthy in the sense that it's actually enhancing your life. It's making your life feel more whole, more peaceful, whether it's with food or relationships or within intrapsychically as well. Social justice is also a part of health inclusivity. So just kind of getting toward the end here, this is the part where I don't wish it was this way, but it is this way, that I feel it's important to prepare for your visits. And it's important to first start to know, first of all, that you actually deserve to be treated with respect and decency. You have the right to leave the office. You don't owe anybody anything. And you're allowed to both reject and object any intrusion into your psyche that actually it causes you to experience shame. And you need to reject and object that, if you can, as quickly as possible, because it's every time you hear any word uttered of it, it's really not healthy for you. So I urge you to reject and to object. And if that's really, really hard, I urge you to have an ally to go ahead of time and to really think ahead of the time how you're going to handle it if you do experience that. So you're not thinking, because in the moment when it's happening, a person is generally quite rattled and shaken. And because of stigma and because of the internalization of weight stigma, has this sort of automatic way, and not everybody's the same, but has this automatic feeling of like, I am defective, they are right, I am wrong, and of sort of quieting down and just feeling like they have to suck it up, they have to take this, they have to eat it, And so it's important to go ahead of time, like, wait, I'm not going to eat it. I'm not going to tolerate it. Experiencing weight stigma is very, very, very bad for you. It's very bad for your kids. It's very bad for our schools. It's very bad for our communities. So it is very important to protect yourself. You will probably need to emphasize, okay? And I suggest doing this ahead of time to let the doctor know that you do not want to focus on weight, but rather health. I would suggest letting the doctor know that before the appointment. And that if they attempt to talk with you about weight, that you will leave. You can tell them, I will leave and I will find another provider. you can potentially give some handouts, and we'd like to make some of those available to you. But it is important to do this on the front end. You are allowed to think of a physician as your healthcare partner. You are not, they are not your superior, whatever. That's your healthcare partner. You're not the minority owner in the relationship. It's a collaborative relationship. And you also have the right to choose whoever that partner is going to be. So we've got to know what defines weight stigma. Okay. This is kind of like what we need to do also as physicians. We got to train our office staff. We have to develop awareness of the needs of our patients. We have to train staff on the procedures about weight, whether we even need to get the weight, because that's a whole thing in and of itself. Talk about language around talking about medical problems that's not focused on weight. We only want to focus on like health inducing actions and behaviors, and usually helping people figure out like a good way to be healthy is to frame it under self-compassion, as opposed to some kind of like chasing some number or some weight. It's like, how can we work on self-compassion right now? How can we work on self-care? And that self-care may or may not be present in the setting of positive body image. You may have a very difficult time with body image, that in fact very, very many people do, and that isn't fun. At the same time, you do deserve self-compassion, for yourself to have compassion, and you deserve gentleness. You deserve gentleness and gentle interactions. You can review literature, and you have, again, the power to leave if you need to. I think it's important for us all to be aware of like how the paradigm of intuitive and mindful eating, as opposed to diet culture and external regulations. Many of the interventions that might be prescribed to you are going to be harmful, so you don't want to engage in those. If you're a doctor, don't shy away from your patients you're going to be as a doctor. I don't know if there's doctors on here, but hey, if your patient's coming at you and going, that didn't feel right, like be a big girl, accept what your feedback is that you're getting. Don't assume that somebody's eating more unhealthy because of their size. Somebody, even sometimes we make the assumption that, anybody that's in a larger body is binge eating, for example, or, binge eating disorder doesn't happen in the setting of like a quote normal. So I had binge eating disorder, I didn't know there was no such thing as binge eating disorder when I had binge eating disorder, but I didn't even know I had an eating disorder, but that's another subject. But, if you have disordered eating or eating disorder, it doesn't like binge eating disorder isn't the person in the larger body. Anorexia nervosa is not the person in the smaller body. So we have to stop being, I'll say ignorant around that. Doctors need to be educated around the health risks of weight cycling. Weight cycling is very dangerous. It's very hard on your cardiovascular system. And it is not safe. And it really it demands a lot of your body, mind, and soul. So it is more stable to be at a like higher weight and stable than to have your weight cycling. It's much more stable. It's okay to set boundaries with providers. And it is sad to know that the doctors may not know any better. Be prepared to find a new doctor. And I always say, be a lion or a lioness. You're allowed to give out a roar if somebody gets into your relationship with food or your body. This is your sacred self. This body you have is your, I'll say gift from God, but whatever. This is us. This is our gift this is the one thing that we have. It's sacred. It's ours and ours alone. And there's nobody else that is going to know better ultimately on what feels okay to you or not. We have interpersonal needs and we have physiological needs. The more we can attend to those physiological needs and those interpersonal needs, the healthier we're going to be. It's not by declining our hunger, it's not because hunger is a need, it's a physiological need. We actually think of appetite suppressants as like some great thing because you're supposed to get rid of your appetite. Appetite suppressants are not doing anything healthful for you because your appetite is a voice of what your body physiological needs. You don't want to suppress your appetite. You want to honor your appetite. And nobody else can tell me if I feel like having a burrito or a vegetable samosa, or I don't know, like maybe I'll have today, I don't know, maybe some pizza. But nobody can tell me what I physiologically need. Oh, nobody can tell you what you physiologically need because your hunger is your hunger. Don't grant anybody that authority because they're incompetent to know what you need. Only you know what you need as it relates to that. If you want somebody to help you with that or whatever, that's fine. But it does need to be somebody that respects your hunger and your fullness and your satiety and what feels natural for your body to need. We do have to recognize what the influence of weight stigma on current treatments. That's a big deal. Not all treatment is the same, whether it's healthcare or eating disorder. You can pick from a lot of different doctors, and when it comes to treatment, you can pick from a lot of different treatment centers, and you have to know what is the philosophical and guidance of those programs. And that's what I always like to say is that, a lot of treatment, and this sounds a little bit, I don't know how this sounds. I'm just going to say it though. There's a lot of programs and treatment that's just kind of been built really quickly because there was a need for more care, and that's a good thing. But there wasn't always like principled care available that was based on truly understanding these conditions. So I kind of put it to like, if you think about a school, right? You can have a school that has a principal's office, a cafeteria, playground, a library, classrooms, desks, blah, 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 right? And you have a school, right? But that school maybe doesn't have any values or guidelines or principles, right? It's just a school and people go in and there's no heart or soul to it. Treatment has to have a soul, right? Doctors have to, when you're getting healthcare provider, you have to have a soul to soul connection with your healthcare providers, and treatment has to have philosophical like understanding of what their principles are. Is it a place that is health at every size oriented, truly, not just bullshit, not just somebody, thought that sounded like a good acronym, but is it really firmly embedded in the whole principles? Is that place going to cave to you if somebody comes in and says, oh, I need to lose weight? No, you call my center and they say, I have binge eating disorder, I want to lose weight or whatever. No, that's not what we're doing here. I don't want to entice people into my center by showing them a movement schedule and a Pilates equipment. It's about self-care. So programs have to have principles that guide them that are going to help our people heal. And the people running those programs and interacting with people need to understand these principles in a very deep way. I'll just wind up with one little kind of tidbit, and then if you guys want to talk at all about what you want or need, again, it's something you don't have to. It's just if you're interested, I will welcome you to do so. But I'd like to leave this little message of something that helped me is the idea. I read Eric Fromm, Art of Loving, when I was in college, and he said any kind of art requires concentration, knowledge, respect, and discipline. And so I kind of turned that into like how I could sort of heal from my eating disorder, and just maybe how I could try to live, and just realizing that as we concentrate more upon ourselves, as we get focused in and zero in on ourselves, which is sort of like mindfulness, he calls it concentration, that concentration leads to knowledge. Knowledge is really where we start to understand in a deep way, like who we are, and we connect the dots to who we are now, who we were, who was around us, how we formed as a result of that. So that knowledge is really important because that knowledge leads to respect. We start to, instead of beating ourselves up, we understand and we really respect ourselves because we see, what we've been through, and we see what we've been taught, and we see where we were injured, and we see where we were traumatized, and we can begin to respect ourselves and realize, wow, holy shit, I'm a pretty amazing person. And then that respect leads to discipline. But he talked about Eastern versus Western. So Western's the no pain, no gain one, right? Screw that. Eastern is you do something because if you didn't, you would miss it. So I talk about it as far as, like, for me, yoga. I don't go to yoga I don't count my steps. I don't say I need to go to yoga Monday, Wednesday, Friday, or some crap like that. I go to yoga when I feel like going to yoga because it's inside of me. It's in my intrinsic soul that I hunger to go to yoga. If I don't go for a while, I'm like, damn, I need that, And so that respect leads to that, and that discipline that really is really more around self-care, whatever the domain it may be. It may be how you nourish your body. It may be how you get your hair cut. It may be that you let yourself have a nap. It may be that you decide that you're going to go to movies on Saturday night, or just whatever, like, kind of thing it is that gives you, that sense of, like, I'm caring for myself. Could be that you're going for a walk. Could be that you're planting flowers. It could be that you turn your phone off, whatever. And then that leads back to concentration. And the opposite of that is what ends up happening a lot in our society. And it's because of contempt and chaos and ignorance and mindlessness that we get sucked out of that. So we have to push back, to reach those ways of being. So I read a lot of self-help. There was no eating disorder programs, and I didn't even know I had an eating disorder. So I was just, like, reading self-helps at a highlighter, and I was reading. And this is just something I came to when I read from, and so I equate it to all of this. I try to tell my folks that I work with the idea of choosing the loving behavior. I call it CTLB. So whether we have loving feelings or not, we can really try hard, and sometimes we need others to help us to choose the loving behavior. And that, feelings chase behavior, as I say. So the more we're able to behave in these loving and self-honoring ways, we are getting healthier. And we're taking better care of ourselves little by little by little. So, and sometimes when you have all these things coming at you and the trauma of weight stigma, you can get into this, like, shame spiral and dissociation and avoidance because you're hurting and you're getting hurt. And that takes a lot to power through. And the thing I like to encourage is, like, breathing and letting it go, or calling somebody and then choosing the love behavior. Even if I feel shitty right now, right? Even if I feel negative body image or whatever, I'm going to choose this loving behavior. And it could just be the littlest thing, but I always like to encourage people to choose the loving behavior to get where they need to get in this world. I think it is 1:00, but I do want to know if there is anybody that wants to put into the chat anything, and you don't have to. If you want to put anything that you would like to get from your providers, please feel free to share it or not. Thank you very, very, very much.
Thank you, Wendy. A lot of really good and important information that you shared. So far, we don't have any questions, but I thought that you and I could just do a wrap up of the week. This is the last talk of Weight Stigma Awareness Week. And so we are about to put the lid on it. And
okay. Can I just say really quick?
Yeah.
I wanted to, whatever the comments are, can Stephanie save those so I can read them later, so I understand what people are feeling during the talk? I very much want to be able to review that.
Yeah, I'm not sure if they can be saved, but Stephanie will know what to do.
Well, even screenshot it or just something. I just want to make sure I can review that.
She says yes, she will do that.
Okay, perfect. Yes.
So if you don't mind, I'll just start with my wrap up for the week. So thanks to all of you who are here. You get to hear the wrap up. We, Wendy and I started this in 2011, just after the Binge Eating Disorder Association was started, which she shared at the beginning. We really believed that if we were talking about binge eating disorder in the eating disorders community, that we needed to talk about weight stigma. That was our starting point. And even though I'm a fat woman and I have lived with the stigma and the trauma of being fat my entire life, I had a ton to learn. And I have been biased toward fat people. And I'm a white, privileged person. I have education privilege, marriage privilege, skin privilege. I'm cis and, heterosexual. And so I have all this privilege. And so I had so much to learn, even though I had actually experienced it. So it has been this long learning process over the last, 12 years, I guess, or no, almost 15 years. So this week really means a lot to me. And it also means that it is a place where we all get to learn together, those of us who are any sized and in any, whatever our job is, but especially those in the eating disorders community, because we still have such a long way to go. I hear so many stories on a weekly basis. I'm interacting with all kinds of people, and on a weekly basis, I hear about how people have been treated by their eating disorder clinicians and dietitians, and especially in higher levels of care, where people are just thrown into a milieu, and what their body size means in that milieu can be really traumatizing to that person. And I had my own experience in eating disorders or eating disorder recovery, of being told that I was somebody's worst nightmare. That goes in and it never leaves you. And I've done so much work over the years, but when I think about that, I just think about how awful that made me feel. And it went right in there to my core self. And it just confirmed everything that I already believed about myself and my body. So it is critical that all eating disorder practitioners get trauma training, and that you're able to understand that weight stigma is a trauma, and that you also understand that we really need to center, when we're doing this work, we need to center the fattest among us, and also the people who are at the most intersections. So when I think about my advocacy and activism, I can't think about just me. I have to think about a super or infinifat person who may live, may be BIPOC, may be poor, may have all these other intersections that really make life difficult. It's all of those things together. That's where I have to go with my activism. So it's really important when we're thinking about this, that we're thinking about those who are being harmed the most. And yes, we have to do activism in the eating disorders community and everywhere else. But we really need to be listening to those people and what their experiences are in comparison to me, who is, white, mid-fat with lots of privilege. So I really appreciate everyone's attention to this week. And, when you have a chance, go and look at all the hashtags and look at the stories that have been shared. They're really heartbreaking. But I think it's people, being honest and putting out there what needs to be heard and understood. And we need to thank them for that labor. So I appreciate everyone. If anybody ever wants to get in touch with me, I'll put my website in the chat here, but everybody can find it, I'm sure. Yeah, just thank you for participating and for being willing to learn. Wendy, you want to pick it up from here?
Everything you said, Shavis. I just want to say that so many people made this possible. And I want to thank those folks. And I want to thank Shavis. I want to thank Cynthia. I want to thank the people at Within. I want to thank people at Bell Ivy. I want to thank all the people that contributed and did the presentations this week. I've learned from you. And the Impact Council people, I want to thank everybody there, but for the grace of God, walk I. And every day, you know, of my life, I encounter people that have experienced incredible pain. And every time I'm with you all, and every time I talk with you, and every time I sit and listen to somebody, it seeps in and it gives me a gift, you know. And so I've gotten a lot out of this week. So just thank you guys. And I really want to make the world, I want to see a time in the future when the general person actually knows what weight stigma is, and that weight stigma is intolerable. It is something people know about, and it's intolerable and unacceptable, and it is discrimination, undoubtedly. So I'd love to see that kind of a thing happen eventually. And I do think we have the power, with this to keep going and getting things better. So I guess you could say that's a dream that I have. So I think that's it. Thank you guys so much.
Wendy, we do have one question.
Yes.
Kathleen asks, I've been told I have to be weighed per Medicare guidelines and how best to respond. That's actually not true. There's a caveat, or not a caveat, but it's physicians are graded. It's a merit-based payment system in Medicare. And so if they don't weigh you, that is essentially a tick for them that, that they didn't get your weight. I'm putting a link in the chat that you can read about this. And it's from Reagan Chastain, who of course is so smart about all of these things. And sorry, I'm just getting this and sharing it with you. But you actually don't have to. The doctor is going to tell you that you have to, but that's not true. So I will put this link in the chat for you, and it is a little more complicated than somebody on a commercial payer. But you actually do have a choice, and your doctor's probably going to argue with you about it, but the information is there for you.
Everybody, I hope you all have a peaceful weekend, and wishing a lot of gentleness to everybody. And I guess we're wrapping, right?
We're wrapping.
And we will continue to march forward and appreciate everybody's being here with us.